Imagine your lungs as a pair of balloons, constantly expanding and contracting. But with asthma, these airways can become your worst enemy in a heartbeat.
I feel that. Sometimes it's like I'm trying to breathe through a pinched straw.
That's the wheeze. It's one of the main signs. Then there's the cough that won't quit, especially at night. It's not just a cold cough, it's persistent.
Yeah, it's worse when I'm trying to sleep. Keeps me up.
And chest tightness? Like wearing something that's too small, but around your chest. It often comes with shortness of breath.
Exactly. It's like climbing stairs or catching the tube feels like a marathon.
These symptoms can vary in intensity, sometimes barely noticeable, other times severe during an asthma attack. Recognizing your pattern is key.
I think I'm starting to understand. So, what should I do?
Let's create a plan to manage this. It's all about understanding your triggers and having a strategy in place.
So, how bad can these symptoms get?
They can vary quite a bit. Some days you might hardly notice them. Other times, they can hit all at once. We call that an asthma attack.
What happens during an attack?
During an attack, breathing becomes difficult. It feels like your chest is in a vice grip. You might feel anxious or even panicky.
What usually triggers it?
In the UK, the weather's a common culprit. Cold air or sudden temperature changes can set it off.
What about pollen?
Absolutely. Summer pollen, particularly from places like Hyde Park, can be a trigger. Pets too.
And stress?
Yes, stress from uni deadlines or work can worsen symptoms.
I see. That makes sense.
Remember, understanding your triggers is the first step. We'll work on managing them together. The good news, Lucy, asthma is manageable. If you're experiencing these symptoms regularly, especially if they're disrupting your sleep or daily activities, it's time to address them.
I've been reaching for my inhaler a lot more. It's like my chest is in a vice grip sometimes.
That's a sign we should discuss. You know, asthma symptoms can be different for everyone. Some people have all the signs, others just a few. The key is recognizing your pattern.
So, what should I do?
First, let's ensure we have an accurate diagnosis. Then, we'll tailor a management plan for you. With proper care, you can live your best life, from festivals to fitness classes, without asthma holding you back.
That sounds like exactly what I need.
All right, let's get started. We'll make sure you have all the tools you need.
With proper management, asthma is no longer a looming threat.